I'm an aesthetic plastic surgeon. So I'm doing a trans female breast augmentation today. So the pocket has been already created. First of all, Happy New Year to all of you. So today is second. So let me just discuss with you guys regarding breast augmentation in a case of trans female. So how do we do breast augmentation in a trans female? That is what I will discuss in this particular live video. So any kind of questions regarding this surgery, you can directly ask me. So my pocket is already done. So what is this pocket which I am talking about? मतलब ये जो पॉकेट मैं बोल रहा हूँ वो क्या चीज़ है? मतलब जब हम लोग ब्रेस्ट ऑगमेंटेशन प्लान करते हैं ट्रांस फीमेल का, तो उनका ब्रेस्ट का पहले हमें एक पॉकेट तैयार करना पड़ता है. तो वी मेक अ स्पेस फॉर द इम्प्लांट टू बी पुट इन. So how do we do it? We make small little cut below the breast that is generally 3.5 to 4 centimeter, generally hidden in the hidden areas. Once we cut, we make a subfascial plane. Below the fascia, we put this implant. This implant has been already prepared in antibiotic solution and normal saline. We squeeze it into the pocket to give a round and a curvy look to the breast. So this is what is breast augmentation in a case of trans female. This is also popularly known as top surgery in trans females. Now generally these trans females, they are already on HRT or hormonal treatment. So generally they tend to have a breast bud, but this volume is not sufficient enough to for the implant to sit in. So we make a proper space going by the diameter of the implant, going by the projection of the implant we choose. So we use a software in which in preoperatively we decide what will be the size of the implant as per the expectation and requirement of the patient. And after we choose the implant, the first thing is after anesthesia, we make we make small little cut below the breast, and we make this pocket, and we squeeze this implant into the pocket so that the implant sits snugly. So this is what is all about the top surgery of trans female or breast augmentation in cases of trans female. This is something similar to normal female breast augmentation also, but this generally this population, they have less of breast volume, so we have to choose our implant very cautiously. So any kind of queries you have, you can directly ask me. I know this is early in the morning, lot of people are not there to view the video, but as I have already told, I do the surgeries mostly in the morning hours. Hi Debojyoti, I want to yeah, my address will be sent to you on your link. Any more question related to breast augmentation with a silicone implant? আপনাদের যদি কোনো জিজ্ঞাস্য থাকে ব্রেস্ট ইমপ্ল্যান্টের ব্যাপারে, তাহলে আমাকে জিজ্ঞেস করতে পারেন. আমার সার্জারি হাফ হয়ে গেছে, রেস্ট যেই স্টেপগুলো আছে তাতে আমাকে ব্রেস্ট ইমপ্ল্যান্টটাকে পকেটের মধ্যে ঢুকিয়ে ওটাকে ক্লোজ করতে হবে. দেখুন অনেক প্রশ্ন আমার কাছে আসে ফেসবুকে, ইনস্টাগ্রামে, ইউটিউবে ব্রেস্ট অগমেন্টেশনের ব্যাপারে. তো ওই প্রশ্নগুলো আমি কিছু ডিসকাস করতে চাই. তো অনেকে জিজ্ঞেস করে আমি কি ধরনের ইমপ্লান্ট ইউজ করি. তো আমি সাধারণত টেক্সচার্ড ইমপ্লান্ট, রাউন্ড জেনারেলি আমি ইউজ করে থাকি. মোস্টলি হাই প্রোফাইলগুলো আমি প্রেফার করি. হাই প্রোফাইল ইমপ্লান্ট মানে যার প্রজেকশনটা প্রায় 6 সেন্টিমিটারের মতন হয়. So generally I prefer high profile textured or nano textured smooth implant. I mean round implant. Many a times I use smooth implant also. And then certain myths about breast augmentation, like will it hamper breastfeeding and all. These are basically myths. The reason, as I told you, I put the implant below the gland. So the gland is not at all getting obstructed. So there will be no problem with breastfeeding. হাই অর্পিতা, লিপের জন্য কি করলে ভালো? দেখো, লিপের জন্যে তুমি কি করতে চাও সেটা তুমি আমাকে আলাদাভাবে একটা মেসেজ করো। আমি তোমাকে ওইটা নিয়ে ডিসকাস করে বলবো তুমি লিপ অগমেন্টেশন চাও কি লিপ রিডাকশন চাও। এইটা যেহেতু আমি একটা লাইভ ভিডিও করছি ব্রেস্ট অগমেন্টেশনের ব্যাপারে, এই ভিডিওতে আমি আর ডিসকাস করছি না। তোমাকে আমি আলাদাভাবে মেসেজে রিপ্লাই করব। তুমি আমাকে জাস্ট একটা পিং করে রেখো। আমার পার্সোনাল প্রোফাইল হলো ঘোষ.অনির্বাণ, এতে একটা মেসেজ করে রেখো। হাই নন্দিনী, how much scar is visible? Hi Nomita. So the scar is generally below the breast. It is 3 to 4 centimeter as I told. This scar is generally hidden into the crease, so it is generally not visible. Hi. So any more questions you can directly ask me. Now another very popular myth about breast augmentation with silicone implant is there any problem if I fly? So generally I ask my patients not to fly within few days, but as such at this high atmospheric pressure there is not much problem with these quality of implants. Hello Shiva. Hi Shreya. Yes, happy new year to you. How are you doing? Okay, good. And another thing regarding implant is many people they tell me the results will be fake. I don't want to do breast implant, I want to do fat grafting. Why? They say they feel the results are going to be fake. Trust me, the results can never be fake if the size of the implant is properly chosen and the surgery is well done. The implant will never give you fake look. Whatever size you want, whatever cup size you want, whatever is your existing cup size, we can customize our treatment accordingly so that you don't look obnoxious, you look very normal, you look natural. And another thing, like I get this question very often in my inbox, like why not fat grafting? Why is implant better than fat grafting to me? Look, fat grafting is a very favorite topic of mine. I keep doing fat grafting on a regular basis, but it is something which you cannot do for every female. The reason fat grafting has its limitation. It is first of all not a permanent procedure, unlike implants which can be kept for 15-20 years if there is no issue. Fat grafting has to be repeated after 2-3 years, and females who don't have much of volume, you cannot expect a dramatic improvement in her cup size. The reason we can only inject maximum 400 to 450 or maximum 500 cc of fat, so that can only little increase your breast volume. So I will definitely come up with another live video on fat grafting. This is like I get many questions on fat grafting, but this video is mainly on breast implants. So if you have any doubts about breast implant, please go ahead with it. Like what kind of anesthesia I use for breast augmentation? The anesthesia is same for any kind of breast augmentation, is generally general anesthesia. You don't get to feel any pain. Yeah, definitely post surgery you'll have little bit of pain, that is manageable with painkillers and all. And another thing, how often we need to do the dressing and all. The day we do the surgery, say this patient I'm doing surgery today, after 3 days I will take off the dressing. The first dressing will be little tight, following which we will be putting a tight compression bra, which you have to wear for a couple of weeks, generally the kind of sports bra. So this gives you a roundish appearance. Hi Shantini, is there any side effect with the implant? Look, any kind of surgery, definitely you can have some side effects. With this surgery, as such, there is not much prominent side effects, but yes, definitely infection is one of the complication which we all are scared of. Then hematoma or bleeding, these are certain complications which may arise. That is the reason the surgery has to be done by a qualified plastic surgeon. It has to be done very cautiously. It has to be done in a well planned way. Then another question which reminds me, like how often we should change the silicone implant. Like if I am getting an implant done today, after how many years, মানে কত বছর পর আমাকে ইমপ্ল্যান্টটাকে চেঞ্জ করতে হবে? দেখুন সাধারণত কিছু কিছু টেক্সটবুক টিচিং বলবে 10 to 15 years, some people will say 15 to 20 years. There is no exact number of years, it is something relative, but generally after 10 15 years, 15 to 20 years, you need to remove it. The reason, you tend to develop a capsular contracture. We will discuss about this capsular contracture thing in a different video, but yes, definitely after 15 20 years you need to change the implant. Either you remove it or you reinsert another new implant. So I guess this was a brief video on breast augmentation with silicone implant. Yeah, Borsha, I guess you have joined late. I discussed about this thing after surgery, breastfeeding. Yeah, this is what I discussed at the beginning. It's a very popular and common myth. As I told, it's a myth. That means it's not a correct thing. ব্রেস্ট ফিডিং এর সাথে আমাদের ব্রেস্ট গ্ল্যান্ডের মিল্ক প্রোডাকশনের সাথে সম্পর্ক থাকে, মানে আমাদের যে ব্রেস্টের গ্ল্যান্ডে মিল্কটা তৈরি হয় সেইটা গ্ল্যান্ডের মধ্যে তৈরি হয়। তো আমরা যে ইমপ্ল্যান্টটা প্লেস করি সেটা গ্ল্যান্ডের নিচে প্লেস করি, তো তাতে কি হয়, দের ইজ নো প্রবলেম উইথ ব্রেস্ট ফিডিং ফলোয়িং সিলিকন ইমপ্ল্যান্ট। দিস ইজ আ কমপ্লিট মিথ। If you are scared of doing implant just because of this concept that you will have issues after pregnancy in breastfeeding, then this is wrong. Trust me, this is completely wrong. This is a very popular myth, but this is wrong. The reason, as I told, the implant is put inside the breast below the gland. So milk is produced in the gland. Through the nipple, the milk is ejected out. This implant is pretty deep. There will be no problem. Hi, Mishti. Then হাই সুজাতা, হাউ আর ইউ? কত ইয়ার অবধি সিলিকন ইমপ্লান্ট রাখা যাবে? দেখুন, এটাই আমি এক্ষুনি ডিসকাস করলাম। এটা কোনো ফিক্সড কিছু নেই, এটা 5 বছর কি 10 বছর কি 15 বছর কি 20 বছর। স্ট্যাটিস্টিক্যালি দেখা যায় 15 থেকে 20 বছর অবধি ইমপ্লান্ট রাখা যায়। কিন্তু এটা ডেফিনেটলি একটা ভেরিয়েবল ফ্যাক্টর, এইটার জন্য অনেক কিছু এটাকে there are many factors which guide this, be it lifestyle, be it the kind of implant you have used, everything. So this is all about breast augmentation with silicone implant. Let me again come to the case which I'm going to do, which I'm already doing. So she's a trans female already on hormone replacement therapy for 3 months. She has got little breast bud. We have chosen this 325 cc of round nanotextured implant. The pocket has been already created. The pocket which I choose is generally subfascial, that is below the fascia, below the gland, above the muscle. And I have prepared the implant. I'm going to put it inside and will put a running stitch, mainly subdermal stitches, just to avoid scar. Hi, Prova. Hello. So any more questions? In case you missed out on the video, you have further doubts on this topic, please, without hesitation, you can inbox me. you will definitely get a reply. And I guess that's for all today. I will again come back with another live video very soon. Thank you so much for patiently hearing me. And excuse me for my voice, the voice is still broken. And thank you so much.